Let's talk about difficulties falling asleep. And it's best to look at this based on the age of the child. In younger children that cannot verbalize physical discomfort, one always has to keep in mind the fact that your child may be feeling physically uncomfortable. This could be anything from hunger, having tummy upset, being constipated, having pain, etc. The most common factor that causes difficulties falling asleep in children from infancy age to preschool age is what we term behavioral in nature. And the most common type we call behavioral insomnia of childhood, and this occurs in about 25% of children. And as children get older, anxiety can start to play a role. This could be fear of the dark, separation anxiety, anxiety as a result of environmental stresses. That could be domestic violence, it could be economic stresses. Child could be being bullied at school. And then there could be academic stresses, stresses related to school failure as a result of learning disabilities or ADHD, etc. So let's talk about behavioral insomnia of childhood. And there are three types of this condition. We call them, one could be sleep-onset association type, then there's the limit-setting type, and if you put two together, you have the combined type. But first, we need to understand two very important key concepts in this condition. The first is what we call sleep-onset associations. Now, for all of us, when we go to sleep at night, we associate certain behaviors with falling asleep. For example, it may be we need to read until we fall asleep, or watch television, or we may adopt a favorite sleeping position. We may lie on our stomachs, on our sides, fluff our pillows in a particular way. But there is a behavior that we always associate with falling asleep. And so we call that sleep-onset association behaviors. The second key concept is to understand that it is physiological for us to wake up spontaneously. For all humans to wake up about 3 to 5 times a night for no particular reason. We just wake up spontaneously. And when we wake up, we have to be able to put ourselves back to sleep. So I'd like to give an example to illustrate how this all works and how it ties together. You have a 9-month-old son that was admitted to hospital for surgery, and he's now recovering in hospital. He's been having a difficult time falling asleep because of pain and discomfort, and you've had to resort to holding him to comfort him. And this really does help him fall asleep. He's finally discharged and he's doing very well. He's eating well, he's pain-free. And you get home and you place him in his crib, and immediately he cries and fusses and is unable to settle to go to sleep. You have to pick him up and cuddle him, and you put him in a rocking chair, you put on some soothing music, and you find that he quickly settles and falls asleep. And as soon as he's asleep, you put him in his crib because you've got to attend to other things. And the moment you release him, he opens his eyes and he begins to cry. You pick him up and cuddle him in the rocker until he falls asleep. And you soon learn to be absolutely sure that he's sound asleep before putting him back in the crib, for fear of him waking up the moment you put him down. About an hour after he's fallen asleep, he starts to yell and cry for your attention. You rush in to make sure that he's not in discomfort, and then you resort to picking him up and cuddling him and soothing him until he falls back to sleep before you place him back in his crib. You breathe a sigh of relief, thinking that that's it for the night, only to have the same behavior repeat itself 3 or more times in the same night. So, in this example, your child has behavioral insomnia of childhood, sleep onset association type, because he has learned to depend on being soothed rather than being able to self-soothe. In other words, he needs a third-party action to help him fall asleep. He is unable to use his own resources to fall asleep. And he has difficulty falling asleep both at bedtime and also when he spontaneously wakes in the night. There is another form of behavioral insomnia which is called the limit-setting type. And this tends to occur in older children around preschool age. An example of this would be your 3-year-old or 4-year-old child who starts to make excuses while she cannot go to sleep at night or stay in bed. and she may may make multiple requests asking to stall essentially going to sleep. She may say, I need water, I need to use the bathroom, I need to say goodnight to mom or dad or my brother, or I need a snack, or I need to check on and say goodnight to my pet, etc. Essentially, this is a limit-setting disorder where the parent is unable to set a boundary. And this could be for many reasons, and we'll talk about this and how to manage this in a subsequent video. Some children can have both difficulties with sleep-onset association, in other words, sleep-onset association issues as well as limit-setting issues. And when you put this together, we call this behavioral insomnia combined type. In the next video, we'll talk about what we can do to help fix these problems of behavioral insomnia.